voucher assistance so that the families feel they can send their children to the programme. And this has been really successful, this wraparound sort of care for the children. And it's the first time we've actually brought all 4 kind of interventions together in this way. And the second learning is that we really need to assess the children to understand their learning level and then group them by their learning level rather than their age group. And so many of you will know Pratham and their really amazing, groundbreaking model, teaching at the right level. And so we've been using this in the catch-up clubs model. So all the facilitators, they use a really simple learning assessment. They organise the children then into leveled groups, and then they follow targeted activities to help them progress through basic literacy and numeracy. And as the children progress through the 12 weeks, it really builds their confidence because they're tested every few weeks. Not a very rigorous test, just a few minutes every few weeks, and they can see that they're really getting progress from learning letters to words to sentences to stories. And actually, in the pilots that we're doing in Uganda and Colombia, we've seen really positive results of this so far. We've seen high rates of retention and advancement across all the learning levels. And 100% of the children who remained in the catch-up clubs in Colombia demonstrated proficiency in the highest reading level at the end of the pilot. And actually, the children really enjoy doing this as well because it's quite an interactive way of learning. There's singing, there's dancing, but also, so it's really fun for them. I was actually on a call with some of the children a few weeks ago, learning about the program, and they were just so thrilled and excited to tell us what they do every day. And the third learning is to really build flexibility into non-formal education and mental health programming. So thinking about the activities you do, the time that's needed for the children in the setting, and also the kind of delivery modality that you use. So, for example, in Cambodia, where we're piloting the program, the kind of the syllable and word relationship is different from other languages, so that some of the activities have to be changed. And also, in some circumstances, it's fine for children to do 1 or 2 hours a day, but in others, they want to do a long session all at one time and a shorter session here and there. So we change it depending on what's needed for the local context. So just to wrap up, there are 3 learnings that we've had from the catch-up clubs. The first is to design programs that break down the silos and really put children's needs at the forefront. And the second is to group children by their learning level rather than their age. And the third is to build flexibility to the local context and ensure that the program is really suited for what that context has. Thank you.
Thank you, Emma. And following the thread, it's really interesting to listen about the evidence-based and how this reinforces the fact of how fundamental and imperative it is to provide mental health and psychosocial support in programs that you have just highlighted. And so we move on to the next speaker, who is joining from UK. And sorry if I may pronounce your name not in the right way, but Maria King. She joined the Arsenal Foundation as a director in 2020. And she's using the power of football in Zaatari camp, in the Jordan refugee camp for Syrians, in their Coaching for Life program. She's been partnering with Save the Children and with the Mental Health PSS Collaborative. And I'm really curious, because I've seen it with my own eyes in Zaatari. I'm really curious to hear from you what are your learnings from this program, and how football promotes essential psychosocial support and basically mix the fun together with the sport and what is needed for youth in the refugee camp of Zaatari. Over to you.
Thank you very much. And I'm delighted to be here today speaking on this important topic. But yes, in relation to Coaching for Life, what really struck us as the key learnings or phenomenal things. I think one is no one can deny the absolute joy that football brings to kids' lives. and I recently returned from Zachary, and the joy from the children's faces when the football pitches were reopened and kids could rejoin was just fantastic. Um, so it's really, really, there's something very, very joyful and something very heartwarming in seeing the power of football to do that. So, you know, for us, the learning is like, how do we use that? How do we use that joy and well-being that comes through the football, and how do we build the resilience programming into that? So one of the first learnings we took was, before collaborating with Save the Children, we took over 35 years of Arsenal working in our local communities here in North London, which are pretty deprived communities. And we've been working with kids in those communities who have been both victims and perpetrators of violence. And so we had a lot of experience around the power of football to change lives in that setting. And we thought, how can we combine that with Save the Children's experience of working in humanitarian settings over 100 years, and their child protection and MHPSS experience, and bring that together to develop a program called Coaching for Life. And then we also wanted to make sure that bringing that together and doing that programming, where we're using the football as a way of getting the children to come to the programs. We build really good pitches. We train the coaches in the Arsenal way. We had our coaches embedded in those communities in Zachary, training the Syrian coaches, and then combine that with all the training from Save the Children. So there was a really good holistic package. We also ensured we got the parents involved and we got the wider communities involved as well. And so Coaching for Life became more than a football program. And I guess that's one of the learnings, is the impact it can have. And as many of you will be aware, some of the key challenges in the camp, which have actually got worse since COVID, are early child marriage and child labour. And it's been really interesting working with the girls. When we first started in Zachary, girls weren't encouraged to play football. So there was a lot of barriers we had to break down in terms of, we had to ensure that the pitches were covered when the girls were playing football. That was fine. The girls themselves came up with those ideas. They had to wear long sleeve clothing, etc. And now I'm really happy to say we have a 50-50 gender split in the programme after 3 or 4 years. But the most important thing, and the learning from all of this, is that the girls found their voices. It's about coming back and being with their friends and being with their peers, finding their self-confidence through the resilience modules, learning how that translates on the pitch and playing football, learning how to deal with difficult emotions. And then a number of those girls are now campaigning against child marriage in the pitch. So linking that to a football club in North London is just an amazing learning in itself. How could you imagine that a football club a million miles away would have that effect on young girls? So that's been really interesting for us to see that. And then we didn't want to just do the program ourselves and with Save the Children. We wanted to bring in the MHPSS collaborative and get them to assess what we were doing and to see were we on the right track by combining our expertise and Save the Children's expertise. And I'm very happy to say that the learnings have come through now from the collaborative, and it's looking like the really important factors are things like a sense of belonging. A sense of belonging is really, really important to the kids. And they feel a sense of belonging to actually the Arsenal family, which as a football club makes us really proud, because that's part of our values as a club and as our values of a club to our local community. So for that to translate globally is really great. And the other thing is that comes out really, really strong is the importance of a trusted adult. So having a trusted adult in their coach that these kids can turn to. And so that's been incredibly important and a really strong learning for us as well. And just the sense of sheer joy and the kids coming back. This program, the Coaching for Life program, is done in 20-week blocks. And we had a lot of debate at the beginning of co-designing this program. And we weren't sure that the kids would stay and engage for 20 weeks. But I'm happy to report that they did. They kept coming back for more. So the kids themselves were understanding that this was benefiting them. And then we have lots and lots of anecdotal evidence every time we go to the camp. As I said, I was there just 3 weeks ago, where parents are telling us the behaviour in their children has completely changed. whether that was difficult emotions, whether it was like anger or fear or whatever it may have been, being disruptive with their siblings, or just, you know, their mental well-being. A lot of that has been impacted by Coaching for Life in a very, very positive way. So, you know, we feel that the parents are encouraging us to do more, the community is encouraging us to do more, and the kids themselves are speaking to us, telling us they want to do more. So it feels we're on the right track here, and it feels as an informal way of educating kids, particularly around mental health, this is a really good position to be in. And whether that will lead to a pathway to particularly get kids who've dropped out of school in the camp to suddenly start going to school again is kind of probably a bigger stretch, but at least they're in a better, you know, their mental well-being is being addressed, and they feel that that's all in a very positive direction. So the need is still huge in Zachary. We will still need to do more, and it's about now, can we scale what we're doing now that we know it's having a good impact?
If I have, yes, my voice is back. Fantastic. I feel this power of you know, joy, of well-being, and a really practical example coming from the Zatari camp. So we will leave you a couple of minutes at the end for questions. We have our two other speakers, and I'm happy to present Teresa Sorde Marti, also I think calling from the UK. She's a Harvard doctorate holder and associate professor of sociology at the Universitat Autònoma de Barcelona. And she has an interesting experience working on effective practices in education and mental health, integrating refugee children in 6 European countries. So we are moving across the globe, and we would like to hear from you what is your refugee aid project about. Please, over to you.
Maybe she's on mute.
Yeah, please.
Now we hear you. We didn't hear your beginning, so if you could just restart.
Okay.
Thanks.
Okay. So I was saying that we are in the first year of the refugee project, and this will be an example, another example in which the education and the MHPSS, the mental health and psychosocial support, will meet in the lives of the children and the minors across Europe. Our first key learning, one of the basis backgrounds of our project, is the importance of implementing only those actions that there is solid scientific evidence of social impact. It's not only a question to preserve and to promote these non-formal educational settings, but also to see what we do in these settings. So for years, we had long experience and very good experience with evidence-based programs, but sometimes and in many examples, they have not been enough. So now citizens are claiming for one step beyond, which is to stop testing with other people's life and to implement only those actions in which we have already showed to be effective in diverse contexts and with diverse constituencies. That, in our case, in the case of the Refugee Project, is to promote academic learning, the sense of belonging that has already been mentioned, and the well-being. So we need to tackle both education and MHPSS at the same time, because they reinforce each other. An example of these practices that we will start implementing next year will be the successful educational actions that have been identified by the Included Project, European research project. And while I speak, there are more than 9,000 schools and other non-formal settings like cultural centers, hospitals, prisons in Latin America and Europe that are being implemented. For instance, the Portuguese government has taken on these successful educational actions as one of their policies. And we have solid evidence that these successful educational actions are achieving social impact. A first example of these successful educational actions are the dialogic gatherings on universal literature, but they can also be applied to classic music, art, or science. And they have also been shown to be very effective in teachers' training. The idea is to take those high culture and hard to reach works to the very grassroots communities, to the citizens. All participants read the classical universal book from James Joyce to the Mahabharata by themselves or with help if needed, and select a paragraph to exchange at the circle and prepare an explanation why you choose that paragraph. One person serves to facilitate the egalitarian dialogue session, giving priority to speak to those who have done it less. The research that we have conducted on these dialogic gatherings shows that not only reading and comprehension and vocabulary greatly improves, but also the shared meaning making, the collective experience of sharing and connecting the books or the artistic or the music with the personal stories, and also is improving friendship, solidarity, and prosocial skills among all participants. This is done with minors, but also with family members, with migrant families, for instance, across the world. A second example of these successful educational actions are around the promotion of educational participation of families and communities. And I will highlight here only two arrangements. The first one is the interactive groups that can is a way to arrange the groups, the student groups, and it's also been implemented in non-formal settings in small heterogeneous groups with the key promotion of interactions by an adult or a person who facilitates, there is no need to have any type of preparation or any type of credential. Anyone can facilitate an interactive group, with the idea that it's through the interactions among the students who finish that activity, so the students can rotate and can end up doing all the small activities in each interactive group. The research shows great improvements not only in learning outcomes, but also in the living together. The students become more friends and more solidarity among them, and also well-being, because when they learn, they are also happier. So based on the promoting, so the second arrangement of this educational participation of the families and the communities is to extend the learning time. For instance, in many of these settings, the library or a community center has been arranged to serve as an after-school program run by a volunteer, and to support the students and promoting this type of interactions in these places. This has also been showed great improvements in academic learning and other learnings. Just to conclude my speech here, not only to some of the conclusions could be not only the importance of the evidence of social impact, but also the promotion of the co-creation methodologies to involve all the communities, no matter their socioeconomic status or their educational credentials. Everybody can participate and should participate, but also, and the third learning would be the importance of the promotion of interactions. And I would leave it here. Thank you.
Thanks a lot. And you spoke about collective experience of sharing, and I think this panel shows from different perspectives that we need to really pull ourselves together to make sure that the message of providing psychosocial support and mental health in formal and non-formal settings is essential. And it's a nice way of ending with Dr. Iyad Zahoud, who I met in Gaza. He's a psychiatrist leading the UNRWA head of mental health and psychosocial support unit, and dealing with 254 school counselors in Gaza. And so we've moved across the globe from non-formal, and now we have 4 slides to end our presentation, back to formal education.
Okay, thank you very much. And yes, I will be pleased to present to you our experience with mental health and psychosocial support in Gaza Strip in UNRWA. I work for the United Nations Relief and Work Agency, which hosts more than 284,000 kids in our schools. We have more than 278 schools across Gaza Strip, and as mentioned, we have 254 counselors working in these schools. And although this number of counselors might sound very big, but it actually does not address even 10% of the need of the community in Gaza Strip, and especially when it comes to psychosocial support and counseling. Just to give you an idea about our last experience, because this is something that I would like to show you as a model of how we structure our interventions so that we can reach as much as we can from our children. In May 2021, we had the last cycle of violence, large cycle of violence, because from time to time, we always have these kind of incidents, but the largest one recently, what happened in May 2021, when our school children were preparing themselves for the final exams of the year, and we were under this COVID measures for more than one academic year. Children were preparing for the final exams. All of a sudden, this cycle of violence started, and then instead of the children entering the final exams, they have to live a very dramatic 11 days of war-like situation. Now, after this war-like situation and the final exams were conducted, and then we went into what was supposed to be a summer holiday, and instead of leaving the children, with their sufferings, UNRWA organized summer activities kind of camps, and we were able to host almost 98,000 children in these camps. And what we did this time is that we included counselors in all these camps. So we had almost 90 schools that were used as summer activity centers. This type of organization actually had 2 functions. First, because children, they have been under COVID measures, kind of closure, curfews even sometimes, and now we didn't want to leave them after this exposure to cycle of violence, leave them again at home. We brought them back to the schools, but we brought them to schools not to have academic school, no, but we wanted the schools to be utilized as a source for fun, for activities, for art, and for practicing, some hobbies that the children have. While these children were playing normally, this is our strategy actually to deal with trauma, is to provide the children the environment to normalize their life again. This is the best, tactic that we use when we have such a massive trauma. And in the meanwhile, while children are doing their hobbies, they were observed carefully by the counselors, and we were able to detect almost 10% of the children, based on the counselor observations, they were found to be in need for some type of counseling support. So even practicing, playing football or playing basketball or playing some popular activities or doing art activities was not sufficient to take these children out from this trauma and long-term blockage. So our counselors were able to deal with this type of reactions. Of course, in addition with involvement of the families. And then some of these children still did not recover even after our counseling support. They were referred back to the school counselors. When the school year started, they were under observation, and they were under treatment by the school counselors. Now this type of pyramid, which I tried to show you, it gives us gives an idea how we generally deal with the situation when you have such a massive intervention. So when you have a massive trauma, so there are some community-based intervention, there are some classroom-based intervention, and then on the top of the pyramid, the children who do not recover after this two level of interventions, they are treated by our counselors using individual sessions. So all our children, all our community actually, they need intervention. By definition, exposure, in general literature, it says exposure to trauma, after exposure to traumatic event, 25% of people develop type of post-traumatic reactions. In our case, all our community, including all our children, are exposed to traumatic events. So we move to the second level of support, which is more focused, including the family and the classroom. And then the last one, even the ones who do not benefit from this type of intervention, we move ahead to the children who need a little bit more focused intervention. So again, when we talk about the community level, we talk about prevention. And by the way, prevention does not start after the incidents. We already develop kind of social network. We teach our children life skills, stress management, social relationships, all these things even before the incident, so that when the incident happens, these children are able to use this coping mechanism, and this is also with the involvement of the community. Then we move ahead to the more specialized interventions as we move up. This is the type of model that we use actually, and we try to make, we try to be always prepared as much as we can by empowering our community, by doing a lot of parental education, community education, empower them how to take care of their children in normal times and in stressful times. Our school staff, they are part of the community. We have more than 10,000 teachers in our schools. They are also affected by trauma. We cannot ask them to deliver education. We cannot ask them to take care of the children before they take care of themselves. So they are also targeted by our counselors. They receive their own self-care sessions, support sessions, and then they use this model to help their children, and they help the students that we have. So we work with the community, with the school staff, so that our families, our children, are the ultimate recipient of the intervention. So while this being said, while we'll try to compensate for the huge need of support that is needed by the community, it's very important to say that counseling is not a stable, unfortunately, service in the agency. For example, 2 or 3 years ago, we were exposed to a high financial deficit, and we lost 80 staff members who were working as a counselor. So there is a high deficiency in the number of counselors that can carry out all this. And there is also a lack of stability, as usual, in this type of services, which is actually compounding so much our effort to build a stable, resilient system within our schools, which takes care of children, teachers, as well as parents. Thank you so much.
Thank you. And we are left with 1.5 minutes. Thank you for the immense work and for the very much needed, especially after the May last escalation that they are doing. And thank you to all the speakers for the incredible wealth of knowledge, of evidence base, on really trying to improve the well-being of children in being in Europe or in countries that were mentioned. So there is really 1 minute for any key questions, and I don't know if there's a microphone that, yes, over there, that can be, and please address the question to whoever of the speakers you would like them to reply.
Very quick. We've been hearing a lot about EdTech being perhaps arguably the main answer for reaching many, many children and reduce the inequalities in education. However, none of the panelists mentioned technology at all in their interventions. So I'm just wondering what the panelists' view is on using technology to reach the most marginalised.
Emma, do you want to take this?
Sure, I can have a go. Yeah, you're right, actually. None of us did mention technology. I think all of our organisations do some work with EdTech, but I think for, say, the children at least, you know, we take a very nuanced approach to it, and we really focus on what actually is going to deliver learning outcomes. Is it improved quality teaching? Is it an inclusive classroom? Is it you know, the right curriculum, and so on. So our approach is always to look at that first, and then see if EdTech could be useful for some of those to help boost learning outcomes and well-being in those ways. One thing that I didn't actually mention, but kind of related is we're looking at how best to measure learning and well-being outcomes remotely, and for this we have kind of no, low and high-tech ways of doing that, and we're just piloting that at the moment. So perhaps we can have a little chat about that afterwards, if that's useful.
I think we can take a last question. I see this red light, meaning the session is ended, but let's go with the last question. Thank you.
Yes, hello. My name is Dina Asaf. I'm the United Nations Resident Coordinator here in the UAE. Grateful for the discussion today. And I'm very happy to see our colleagues from UNRWA here, and wanted to ask Dr. Iyad if you could further elaborate on the fact that, of course, as you said, all the children are under trauma. How do you incorporate these types of programs while also educating them? When is the time during the day to be able to reach all the children? Thank you.
Thank you. This is actually a very thoughtful question. And you know, there is actually several. We try so much to incorporate psychosocial support and mental health and education in terms of empowering the teachers as much as we can. So teachers, when they actually deliver their classrooms, we ask them to pay attention to such issues that, you know, like children who have poor concentration, children who express such behaviors, and then they refer them to the counselor. It's very important that, as I said, almost 10% of the children after this last trauma, I mean, we talk about older children, they started to express symptoms. So when they are in the classroom, if they are not really focusing or concentrating, the teacher can refer them to the school counselor. If the teacher is able to run the classroom with their presence, we try to address their needs while they are in the classroom. So it relies so much on teacher-focused approach. At the same time, the counselors are backing them up. One very important issue that I already mentioned, that teachers, we did a preparation for the teacher after the war, so that they themselves are able to deal with their own emotions and stressors, and then it's kind of experiential learning. So when they learn how to deal with their difficulties, with the stressors that they experience, they will be in much better position to handle children who are overstressed. And when this is beyond their capacity, then they refer this to the counselor.
Thank you very much to all, and I see we're right on time. Thank you very much to the speakers.